In just 1 week, there were 635 cases of COVID reported among teenagers in Idaho. Those that are 13 to 17 years old. In just 1 week. And according to the Idaho Department of Health and Welfare, that sets a record as the fastest rate of spread when compared to any other age group at any point during this pandemic. And those younger than that, those 5 to 12 years old, they're unable to get the vaccine. They are not far behind that. Maybe not a surprise that this information is coming out weeks after the start of the school year. Here's Katya Stepovic.
We are watching with increasing concern the rising number of cases in younger populations.
Idaho Department of Health and Welfare is sharing staggering statistics about Idaho kids and COVID.
The number of children 12 to 18 that are positive is greater this week than last week. It's growing at an accelerated rate. And our internal data shows a positivity rate of 20%, which is incredibly high.
Dr. David Peterman, a pediatrician and the CEO of Primary Health, says of the 635 cases with kids 13 to 17 years old across the state, 150 of those are primary health patients.
I'm incredibly disappointed and to a certain degree disheartened, because we know something as simple as having our children wear masks in school, and teachers and staff, we can slow the spread of COVID.
Take the West Ada School District, for example, the largest school district in the state with 40,000 students. They started school with no mask mandate. But as of Friday, all students and staff are required to wear masks. Right now, they are reporting 60 active cases in their high schools, 59 cases in their middle schools, and 99 cases in elementary schools. But Peterman says that number is likely much higher because the rapid self-testing kits West Ada is using aren't as accurate as other tests.
If you give these binocs tests to the schools, are they obligated to report to you? The answer is no. They're not obligated to report. And again, they're doing what's called a binocs test. It's not a PCR, it's a quick test, and it's not as accurate. So whatever data I report to you from West Ada, it's not accurate and it's lower.
Peterman says the number of children Primary Health has been testing in the last 4 weeks has skyrocketed, and spread among younger populations is something he says healthcare workers saw coming.
Children are back in school. There is not consistency of mitigation efforts, and those children that are eligible, not enough of them are getting vaccinated.
Roughly 43,000 kids aged 12 to 17 are vaccinated. Peterman says it's the obligation of parents who have children eligible to get vaccinated to do so, because things can get worse.
We are denying care. We are denying care to children. We are denying care to adults. We're denying care to the elderly because we just can't see them because we're so overwhelmed. And something as simple as wearing masks and getting vaccinated could solve these problems. And I'm just pleading with people to do this.
Peterman attributes the increased spread to the lack of mask mandates in school districts. But as we've reported, more school districts are starting to implement those mask mandates, including Boise, West Ada, McCall, Caldwell, and Gooding, among others. Also worth noting, Brian, if a primary health employee has a child that tests positive for COVID, they too have to quarantine until they test negative, stretching resources once again even thinner.
Yeah, the staffing shortages we talked about already making more of an impact on that. So that 635, according to Dr. Peterman, that 635 number probably is higher because a lot of these places aren't reporting.
Yeah, he says they're actually more high because the COVID tests that a lot of these school districts use are not accurate.
Amazing. All right, thank you, Katya.